Hello and welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network. Today we have three guests in the studio. We're going to talk about monkeypox and the monkeypox outbreak that is taking place actually all over the world, but obviously we're focusing here in New Bedford. We have the three guests. I want to make sure I get everybody right. Right next to me is Connie Rocha-Mimoso. She is the Director of Community Health for Seven Hills. And we have next to her is Liza Rebello. She is with the City Health Department. She's the Director of Public Health Nursing. Correct. That's good. I'm 2 for 2. Erica Silva from the Greater New Bedford Health Center. She is the nurse manager there. So I want to thank you all for joining us. I think it's funny that Damone and Cheryl have sent you two here as victims, so it's on them. But thanks for coming in, all three of you. I know scheduling and everything right now is difficult, but I appreciate that. Yeah. So the monkeypox outbreak, relatively new. And Liza, let's start with you health-wise. I mean, this is something that is all over the world, but it is relatively new in the last few months.
Yeah, so monkeypox virus itself is not a new virus. It was actually identified first back in the 1950s with a colony of monkeys who were being used for research. It's not thought that the virus originated with the monkeys. The origin of the virus is not known. But really what's unique about this outbreak in 2020 is that it's the first time we're seeing larger scale person-to-person transmission in parts of the world that historically had not had a lot of monkeypox. So since it was identified, it pretty much had been found in Western and Central Africa and not necessarily widespread throughout the world. So that's what is unique about this outbreak. So much so that at the end of July, the World Health Organization identified this outbreak as a public health emergency of international concern just because of the large scale.
And coming off we're still dealing with COVID right now. Mm-hmm. I think all three of you might want to weigh in on this too, is that we're not talking, I mean, it has the designation as you just said, but we're not talking about the same thing, correct? There's different aspects of this that don't, it's, you know, it's not a pandemic, let's put it that way.
No, absolutely not. All viruses kind of transmit at a different rate or a different speed and different ways that they transmit. For example, monkeypox is highly transmissible through contact, so direct contact between two or more parties. And it can also be found in respiratory droplets. They're not sure how much of it is actually found in the respiratory droplets. Most of it is direct contact between people. So COVID, for example, is transmitted at a very high rate through the droplets. So through coughing or sneezing, it's spread much quicker than something like monkeypox.
And Connie, you're saying the same thing with that too. It's just it's a different beast. Let's put it that way.
It's a different beast. It's not a pandemic, so we don't want to alert people on it. And the transmission itself, is very, very different. It's also very controlled by the individual and the environment that they live in. Compared to COVID, that you're not, we didn't, when we were not able to control it that quick. And monkeypox, we can, and so it's very different, two different things.
Is it a virus? Are we still talking a virus?
Correct.
Yes.
Yep.
Okay. And we know how we know the origin. I guess that's a good thing too. Or at least how it works.
Yes.
Medically.
Right. So unlike COVID, we really didn't have
exactly. That's what I'm saying.
With COVID, it's very similar to smallpox. So we kind of already have that background and know how it transmits and how to manage it and how to decrease the spread. Is
it one of those things like that? A virus that we thought, I don't want to say we had eradicated, but it was really not prevalent in the world, or has it always been? I mean, you said it's been first diagnosed in 1950, but it was not really everywhere.
Right. Yeah. So it was pretty much localized to, like I said, those regions in Africa, and this is the first time that we're seeing that larger scale human-to-human transmission in many different countries. It's now found in all except one state in the United States.
Is that surprising? Like the spread? Is that something that's I don't want to say a concern, but something that surprises people?
It's unique to this outbreak.
Yeah,
I will say, yeah.
The we'll talk about treatment too, but let's talk about for a second who is susceptible to this. And again, we didn't, as Connie said, we don't want to alarm people. This isn't a pandemic,
Sure.
but
Yeah.
who are the folks that are susceptible to this?
Sure. So our higher risk folks that are severely immunocompromised, folks living with HIV, cancer treatment, things like that, they're at higher risk because their immune systems are low to begin with. There is a criteria, so any travel to any of those endemic countries, such as West Africa, or any contact with folks that that have traveled to those areas, you are at higher risk. The first cluster of outbreaks that we saw, I believe was in Europe, was amongst the MSM population, so men sleeping with men. So they were these large areas where there was a lot of direct physical contact. So we saw, a higher rate in those incidences. But we really want to stress the fact too, it's not just those groups of people that can get this disease. It's very similar to chickenpox. It's that direct contact with infected skin or infected cloth, bedding, sheets, things of that nature. So we have seen it spread amongst children in mass, I believe there were 5 or 6 cases throughout US amongst children. So it's not limited to those folks by any means. So it's important to know that anybody can really get it with direct contact, repeated contact.
This sounds stupid, but what are the characteristics? I mean, with COVID, people were always, I don't want to say panicking, but people were concerned about, oh, I've got a cough, but that doesn't necessarily mean you have COVID. So, I mean, there was sort of that, I guess, panic, like you were saying, that people were worried that they had it. But what are the characteristics of this? Is it visual? Is it something that you may have but you don't know it, like COVID?
Yeah, so some of the early symptoms of monkeypox can be those common viral symptoms, so feeling fatigue, body aches, fever, but eventually kind of the telltale monkeypox symptom would be a rash. So individuals will develop a rash. It could be on any part of the body, and that's kind of what might indicate to someone that they have monkeypox, that rash of unknown origin, and that's when we're recommending that individuals see a provider.
So you were kind of compared it to chickenpox? So it looks kind of like that, or measles or something like that?
Yeah, the vesicles are similar to chickenpox in the way they kind of look.
Okay.
So as she said, you'll start with that general not feeling so well, run down fever, and then they'll start to get vesicles that present similar to chickenpox.
We talk about the vaccines, and I want to touch upon them, but I'm curious, if you already have monkeypox, or the vaccine, do you get a vaccine, or like chickenpox, you just have to run its course? Or do you need to get the vaccine beforehand? Is that one of those type of deals?
Yeah, so, and Connie might be able to speak to this better, the earlier after your contact or your exposure that you get the vaccine, the better in decreasing the symptoms that you eventually develop. So if you are thought to have had contact with someone, vaccination is recommended.
From your standpoint too, I mean, you were saying off camera, I mean, you're giving a lot of shots out. Are they people that have already been diagnosed with it, or are they people who just want to prevent?
A mix.
Okay.
So we have had individuals that been exposed.
Okay.
Okay. Not only exposed, somebody told them. We have had individuals who actually had the virus, and we focus a lot on prevention. We want to get to those individuals that are a high risk, like Erica said, and really advocate for them to get the vaccine so they can be protected. It's really about, that protection where people are going to minimize their symptoms if they come in contact with somebody. But we have had, these 3 different, stages of where we're, giving vaccines to individuals that puts themselves at risk, or they're a high-risk population to get the monkeypox. Those who been affected by it because somehow somebody got it, and then those individuals who actually were exposed and were in beginning of stages of monkeypox.
All 3 of you come from, have the same, we're talking the same thing, but you also have different roles to play. And I'm kind of curious and I probably should have asked this at the start, but your different roles when you look at this outbreak. You don't get patients for the city, but obviously the city plays a huge factor in that. Why don't we start from the city end, and then we can work down from your standpoint?
Yeah. So the role of the New Bedford Health Department in this outbreak, so say someone in New Bedford or New Bedford resident is diagnosed with monkeypox, or they're identified as having been a close contact with someone who later diagnosed with monkeypox, we would be notified of that by the state. And the role that we play is we would contact the individual. For example, if they were identified as having contact with someone, we would let them know that. We provide education regarding monkeypox, and we will work with them for the duration of their incubation period, meaning the day that they were exposed is day 0, and so 21 days out from that is the period with which they may develop symptoms. So we make sure that they know what symptoms to look for, how often to check their temperature, what steps to take if they develop symptoms, so how and where to seek care. And we have, periodic check-ins throughout that time with which we support the resident and make sure that they have all the resources and help that they need.
Is this sort of like the same thing with COVID? Like you guys are doing the daily updates with the state?
Yes, exactly. So infectious disease follow-up is something that the nursing division does on a daily basis, not just with monkeypox or COVID, but with any infectious disease that is among a resident of New Bedford.
From your standpoint, you're getting people that go in there.
Yes.
I don't know, is there a test or something that they take?
There is, yeah. So between our urgent care and then our primary care setting, we see all patients, whether they're patients of the health center or not. So if folks identify that they have symptoms or they are concerned, they can certainly come into urgent care or give us a call ahead of time. And we can have them come in and have them tested. So there is a swab that we use on the vesicle, swab that site, and we send it to Quest Laboratories, and we get a turnaround time of a result of about 2 to 3 days. So we can confirm whether or not what the rash is.
Have you been getting a lot of folks there to coming in concerned?
We have some people come in because they're not sure what the rash is, which is okay, to come in, and any new onset of a rash or any symptom is perfectly okay to come in and have that checked. So we do have the capability to test, and we've had a lot of folks call and just ask questions about it too.
How was the testing? I know obviously COVID testing was so important for people doing it, but there's no, I guess, over-the-counter monkeypox test.
Right, yeah, not at this time.
Right, so...
Yeah, with any kind of an outbreak or virus, it's important to test so we know kind of what we're dealing with. Is it a small cluster? Is it a few folks? Or is this going to develop into something that's thousands or millions of positive cases such as COVID? So it's important to identify those folks. That way we can instruct them on how to treat themselves and how to isolate. That way we don't spread the virus anymore.
And Connie, you're in the unique position because you're it for southeastern Massachusetts when it comes to vaccines. Tell us a little bit about your role and Seven Hills' role in that.
So our role is to do a lot of education on the vaccine itself, this vaccine, and go out on the streets actually, and make sure that we give out information correctly, because people panic. Oh, here we go, we're going to have another outbreak, another pandemic. So our job is a lot of education. We do get a lot of phone calls on a daily basis about what it is, what should I be looking for, and I have this, and our job is to educate them, and then at the same time is making sure that they have some kind of primary care to go to, regardless if it's urgent care or their own primary, because they might be in the early stages and it might look like a flu or a sinus infection. Right. So we want to make sure that people, when they call us, that we educate them, and we basically make that primary care referral. And then, of course, administering the vaccines. And
it's appointment too. You just can't show up.
Right. So it's by appointment. You'll have to call in our office, and if somebody says, I've been exposed, and you call, we'll most likely squeeze you in that day. It doesn't really matter. This is such a quick injection, a vaccine. The clinical staff can actually do these, very simple. The process is simple. We ask a couple questions, they do an intake, they go in, next thing you know, they're out, and before they leave, they get an appointment. So if somebody's been exposed, or they believe they've been exposed, or they're high risk and they have fear, we can squeeze them in within that day or the next day. If they call at 4 o'clock, of course, we're going to have to squeeze them the next day. So we've been doing vaccines Monday to Friday.
You've been busy too. I mean,
we've been really busy. We began seeing, that first week was like, we couldn't even, get to the phones.
Right.
Because they were actually calling everywhere, like any Seven Hills office. So, because they needed an appointment. So we see an average of, 25 to 40 people a day.
Do you have enough vaccines right now? Or?
Yes, we do.
Okay.
So we have,
and it's, by the way, it's 2 shots. You should, yeah.
Right. So it's 2 shots. You come in, you get your first shot, and then we schedule your second shot 28 days later.
Okay.
Yeah. So as you leave, you already have your second, shot. What we have found last week, a lot of people were panicking because they couldn't get an appointment fast enough anywhere. We had a few people that canceled last week because they got us someplace else, because it's like they really, are scared. They want to get their shot. But there's no need for that. I mean, unless you've been, exposed, and we can see you that same day anyway, But it's been an interesting, 3 weeks. Actually, 4 weeks. It's been a month already. Yeah, it's been a month.
Liza, you were talking about, which kind of got me curious. You were saying, it starts at day 0 to 21. How long first of all, how long does it take to develop the symptoms? You said, I think 21 days, that's what you meant, right?
Yeah, it could happen.
How long does it last?
In general, about 2 to 4 weeks.
Really?
Yeah, so it's similar to smallpox, but unlike smallpox, the symptoms tend to be less severe with monkeypox.
Okay.
So it rarely results in death. It often does not require hospitalization. It's usually self-limiting, so individuals can manage their symptoms at home. Is typically what it looks like.
Is there I mean, obviously the vaccine, I understand that, but I know with chickenpox, when we were kids, your mother would take care. Is there any sort of home remedy, I guess, to ease the rash or anything?
You might be able to speak to that better.
We've instructed patients, in the meantime, if they do have any painful symptoms, cold compresses, cool baths or showers, Tylenol, just any kind of
symptom management.
Just basic symptom relief.
And they have to be, away from people during that time too.
Absolutely. So during that isolation period, as Liza said, it can, depending on where your symptoms start in that spectrum, it can last up to 2 weeks. So from the date you start symptoms until the day your symptoms end, meaning the vesicles have scabbed off and you have a fresh layer of skin, during that time period you are considered infectious. So during that time period you must isolate. So in the home, isolate away from everybody as best you can. Wear a mask if you have to go into common areas such as bathrooms, kitchen, things like that. Keeping bedding, linens totally separate.
I read that like linens are are a big way to get it.
It is,
which I didn't really think about that.
Yeah, so when the vesicles start to scab and crust off, most of the time if you're sleeping or in bed or wiping with a towel, that's when those crusting will kind of fall off. So if little kids are crawling in bed with you, they've even had some mention of animal transmission too. So you kind of want to isolate from absolutely everybody, which is tough.
Right, and I think, Jim, what we're really, all of us want to do is really be a preventive method where, somebody has it, but let's prevent it from them giving it to somebody else. Let's stop that, at that level so that we don't have an outbreak.
Right.
This is a control outbreak. We can actually control this with some point, it's not like the other, such as COVID. So we're able to control that. That's why I think education is important. People having the right information, and once they become infected, that isolation point is so important, so that they don't transmit it to, the rest of the family, because this is not COVID. Where COVID, we used to see, somebody be positive, and then the next thing you know, there's 5 of them positive. The next thing you know, there's 20, because they all congregated together. This is something that you can control, and not mixing, not washing your linens, your towels with the rest of the clothes are so crucial. And then that vaccine is really, really important for people to take.
And it's I would it sounds basic, but it's probably critical for people to be honest with themselves too. If they've been infected, that they've got to take the precautions too. They can't wait to think, well, maybe I didn't get it. You've got to be honest with yourself and say, I'm going to take precautions.
Right.
And responsibility too, I mean, somebody that has a family at home with, young children, like Erica said, you're putting those young children at risk, so I think it's a lot of the responsibility, personal responsibility, like we said. We can control it, and we can get a lot of data out of it, how people got it, where they got it, what settings they got it, which is amazing, very different. Each person that comes in to get a vaccine shares their story, why they want to take it. And the settings are very different, but also puts them at risk.
And that's something you're keeping track of, that you're, with the figures and the numbers going to the state, like, all right, where is it coming from?
Right.
I mean, New Bedford's been fortunate so far. In general, I know as we're recording the show, we've had one case. It's not a New Bedford resident, but you guys saw it at the health center.
Yes, we did diagnose one patient, not a New Bedford resident, but as we said, we'll see folks from anywhere in our urgent care center. And I think it's important to put it in perspective too. The CDC's update yesterday, the total count in Massachusetts, I believe, was 288 positive cases. If we look at the number of cities and towns in Massachusetts being about 250 or so, that's not even one case per city. So while it is very important to, talk about prevention and how to isolate, it's not meant to, we don't want to scare people either. It's very controlled.
Right. In like the health center, you're seeing people from everywhere. You're not just seeing New Bedford residents.
Correct. So because we're a site that serves the Southeast, we're seeing everybody from Southeast. We're also seeing patients that work in Massachusetts and live in Rhode Island.
Oh, okay.
So because as long as they live in Massachusetts, as long as they work in Massachusetts, they can actually get the vaccine in Massachusetts. A lot of people work in Rhode Island. We're talking about 30 minutes from here.
Right.
So we're seeing people, throughout the whole Southeast. So they're not just New Bedford residents.
Got like 5 minutes left, but I want to make sure everybody has an opportunity to if people have questions and they want to contact specifically your areas of expertise, I want to make sure that you guys are able to give out the information. So we'll go around. We'll start with Erica.
Sure.
If people have questions for you, how can they get in touch with you in the health center?
The health center is open Monday through Saturday, so our urgent care is also available on Saturday for folks that have any questions or symptoms. The phone number there is 508-992-6553. I am the infection preventionist there as well, so anybody can ask to speak with me, and I'd be happy to answer any questions.
So the New Bedford Health Department is open Monday through Friday, 8 to 4. We have myself in the nursing division. We also have an epidemiologist there who's on site. So any questions or information that you need about monkeypox, you can reach out to us by phone, which is 508-991-6991. And we also have some resources and information up on our website as well that people can access.
Connie, you probably have a couple of different things too, because you're probably dealing with questions, but you're also getting people that want to get the shot, which is probably a different number. But why don't you tell folks how they can?
So we're doing these shots at our office on Acushnet Avenue, which is 1177 Acushnet Avenue, Bedford, by appointment only. They will have to make an appointment. The number they need to call, and I had to write it down because, of course, I didn't know about it. How am I going to have this line just going to the clinical site? So it's 774-634-3725. And people can call. We're giving vaccines Monday to Friday until 5 o'clock. But on Tuesdays and Thursdays, we're there until late. So people can call, make the appointment, talk to somebody. And this number directly goes into the clinical staff. So it won't be just anybody answering the phone. They can leave a message. We'll call them back. Let's say somebody's panicking at 7 o'clock at night, Jim. They can leave a message. We'll call them the next day to schedule an appointment. So, or if they need information, people don't have to call us to get the shot. They can call us for any information.
I was going to say, same number too?
Same number, 774-634-3725.
want to give you each to like 30 seconds to sort of wrap it up, because this has actually gone pretty quick, but sort of from your standpoints where you're sitting with what you do, what's the message you want to get out to people? We'll start with Connie this time and go that way.
Oh, so my message is, you have questions, call one of us about the vaccine, get your information, and if you want to get a shot, just give us a call at Seven Hills. But the most important thing is just don't gas, don't be at home, thinking that this is just the flu. Get your information. And if you are in those categories where you fit as a high, risk individual, get the vaccine. I mean, we want to make sure that people are vaccinated for this so it doesn't become a larger issue later on.
Liza?
Yeah. I think it's important. I don't think people should panic, but I think it's important to have information and to know how to use that information, to just be diligent with monitoring yourself. If you're not feeling well, if you have a rash that you don't know the cause of it, to seek out a healthcare provider and to make sure that you're being proactive.
Erica?
Yeah, I mean, absolutely. I piggyback on both what Liza and Connie have said. I think it's important to note that, the virus does not discriminate. It doesn't matter how old you are, your age, your race, your background. It's just important to get that education and those facts and protect yourself.
And all three of you have websites. Your agencies have websites.
Yes.
I know the city's website, like you said, there's information on there
Yep.
too. So
Yep.
people can, if they're a little reluctant even to call, well, at least go to the website just to
Sure.
check it out before you make a call.
Mhm.
Hopefully decide to.
Correct. And also the state of Massachusetts has a wonderful website.
CDC has some updated
CDC,
info.
they have lots of information, but I do know a lot of people like to talk to somebody, one of the clinicians. So it's okay, just give us a call.
Yeah.
Any of us, like they
Yeah.
said, we piggyback on each other.
Right.
We work so closely
Yeah.
with each other that, any of us can call each other and figure out what we're going to do with certain patients.
Well, it's interesting, like I said at the start, you guys are dealing with the same subject, but you all have your own little niches too, which like you said, piggybacks on everybody to make it,
Yeah.
one knows what the other is doing, which helps a lot, and you're communicating, which is super.
Yeah.
I want to thank you. Like I said, I know your schedules are busy. I want to thank you all for coming in. It was a good half-hour discussion, and I do appreciate it.
Yeah.
Thank
Thank you
you
for
for
having
having
us.
us.
Thank
All right.
you.
That's going to do it for this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network. Thanks for watching, and we'll talk to you again soon.